Hey, this is Dr. Dan Person. I'm with Justice Woodward today. Everyone keeps asking who he is, what's his background, and why is he involved. And so we get a lot of questions about that. So I thought I'd do this video. So this is Justice. Say hi, Justice. Yeah, that's Justice.
Hey, everyone.
He's shy. Not really. So where'd you grow up?
I grew up in Provo, Utah, born and raised.
Okay. And you came from a long line of firemen. Tell us, you're a fireman, right?
Yeah.
Tell us about
absolutely.
that. Tell us about your long line.
Yeah, so I'm a firefighter paramedic. I do come from a long line of firefighters. My dad was a firefighter. He served in Provo. My uncle served in Salt Lake. And then my brother, he's in Provo as well. I'm in Orem. And then my little brother just got out of the fire academy, so he should be starting up soon.
So did your grandfather, was he a volunteer fireman or something like that? Or
No, my grandfather was not a fireman, but he was a soldier. He did serve.
Okay. So how do I know you? Where'd you, I mean, I was the Orem City fire physician for a number of years. I don't know how many people know that, but over the firemen, but that's not how I know you. How do I know you?
No, we actually met prior to me meeting your daughter. We met back when my dad and a few of his buddies came to Dr. Purser, and so I've known Dr. Purser for a long time. Then, funny enough, in high school, I actually met his daughter, and we got married.
In high school?
Oh, well, a little after high school.
Okay, just to clarify that. Yeah, so you and Bailey have a cute little girl. Wait, where is Sage? She's going to be in this. Okay, our granddaughter. Tell us about her.
Yeah, she's sweet. She is almost 2 years old, and she's wicked smart and has tons of attitude and keeps everybody on their toes.
And my wife, who calls herself Tutu for some reason, she and Sage are like best buds.
Yep, that is true.
Okay. What's the oath you swore as a fireman? When I went to your swearing in, it's really historically fascinating to me that you guys did that. I didn't realize firemen do that. Is that a national thing? Is that a state thing? Is that an Orem thing? What is that?
No, that's state by state. We swear an oath of office per state, and then obviously we have to agree to follow medical guidelines, medical rules that they set forth for us.
So you're one of, I hate to do this to you, but you're one of the top ICU paramedics in Orem City, aren't you?
Yeah, I do run on the critical care team, so I am a critical care paramedic, and the easiest way of explaining that is everything that you see the flight crews like Life Flight and whatnot do in the air, we just bring that to the ground. We're one of the first departments in Utah to do it. Obviously, it doesn't make sense to load somebody up in a helicopter when our transport time's about 7 minutes, and so we brought that to the ground, and we have a pickup truck that we go chase down really bad calls or inter-facility transports from one hospital to the next.
So what got you into that?
Initially, I wanted to be a firefighter more than anything. Then I went the paramedic route, and Dr. Purser kind of pushed me to continue exploring some other medical options. And so I further extended my scope of practice and care by doing the critical care medicine. And turns out I like that a lot more than firefighting.
It's funny because what we do isn't really critical care medicine of any sort. It is critical, but it's not medicine, really.
Exactly.
So you started at my office at the bottom of the food chain prepping reports. Describe what you were doing, how you kind of came up to where now you're helping me with patients. Talk about your nutritional training you got on top of everything else, and your whatever that is, certificate, degree, whatever you got there. So.
Yeah, so initially started prepping charts. Obviously, I was an EMT, kind of dabbling in the medical world at the time. Kind of started working my way up through following Dr. Purser and sitting in and meeting with some of his patients as he did it, kind of learning the ropes there. I did go through the Purser Wellness course and got the certification that way. And then obviously in the fire world, I continue my paramedicine and then the critical care stuff. And so that's kind of how I came about that, and it turns out I really loved it. One thing I learned from kind of putting the two worlds together is Western medicine has a great place for the emergency world, and then everything extended care outside of the hospital, I've learned that what Dr. Purser does is what's best for patients.
What do you think the responses you get from patients as to how they're doing, What do you see when you talk to them about these vitamin deficiencies, CMA reports?
Yeah. So what I see, obviously, number one, a lot of correlations. When people come in with their symptoms that they have and complaints that they have, that you're able to draw a lot of correlations off that CMA test. And then typically, we're able to draw a lot of conclusions then going to the genetic test. And so it's pretty interesting seeing, the blending of the two worlds there with the CMA and the genetics and figuring out solutions for patients.
Don't you agree that the genetics, I don't want to put words in your mouth, argue with me if you want, but from what I can tell, the genetic issues that people have are usually the cause of the vitamin deficiencies, not the other way around.
Oh, yeah, absolutely. We see that a lot. Obviously, sitting in with a lot of Dr. Purser's patients and the genetic patients, we see a lot of correlation between that, the genes, and then going into the CMA and seeing all those deficiencies and where they come from.
You're one of the reasons why so I don't know if the audience knows this, but all of us are in my office, not just me, but we're the number one ranked MD in solo practice, I guess it's me, but in the U.S. with over 1,200 plus 5-star social media reviews, mostly Google. And I'm number one in the USA now. So because of work like you do, work that my wife does, work that our team does, we're really good at what we do, but we're not perfect, and we're always improving.
Oh yeah, absolutely. Always finding new options for patients.
It took us quite a while to get from you have a vitamin C deficiency to figuring out that, wow, that patient has scurvy, or at least it looks like scurvy. I mean, you can't make that diagnosis legally. Technically, it's not for insurance or anything like that, but sure looks like scurvy because your vitamin C deficiency is horrible.
Oh, absolutely.
Yeah.
Absolutely.
So we're not practicing medicine. We're doing nutritional counseling, just to be sure. But sometimes some things are really obvious. I tell them, go see your doctor. You've got scurvy. Usually they've been to hundreds of doctors or dozens.
Oh, yeah.
Where they see us, don't they?
Oh, yeah. Yeah, we get that all the time. I've been to countless doctors, and I've spent all my money, and this is my last option.
Yeah, funny. We're the last option for a lot of people.
Yeah,
we should be the first, but that way they don't have to go see all the physicians, because it really isn't a medical problem that's really dealt with anymore at all.
Absolutely.
It's really it's a nutritional issue, which is crazy. So
yeah.
So what's been your most interesting case so far? Can you recall one, or does one stick out in your brain?
Yeah. About 2 to 3 weeks ago, I followed up with a patient for Dr. Purser and kind of gave him the notes on it. And it was a younger male, and went from having, 3 to 5 seizures a week to not having a single one for 3 months. And that was pretty impressive to see the progress they've made. And that was, I believe they did the CMA test as well as the genetic test, and that's where they're at right now.
It's funny because we don't cure anything. It's kind of interesting that we can slow things or stop things, but what we do treat are the nutritional deficiencies sticking in front of us. I mean, they're right there. They're obvious. That test is very accurate.
Oh, absolutely.
So, you don't even have to have a license to order the test, obviously, if you're a practitioner. You can set up an account with them of any sort. So it's super interesting. I like that niacin case we had a few, 6-7 months ago. She was having horrible seizures, and 2 weeks later she wasn't. And niacin's deficiency is not supposed to cause seizures.
Yeah.
I found nothing in the literature, and I just was kind of guessing when I looked at her lab results. I'm like, could be the niacin. We'll see. Lack of niacin was really, she had a severe, what we call them super severe, where she has almost no niacin in her system.
Yeah, almost non-existent.
So you benefited from the testing we performed. Tell us about that. Tell us how we came about doing it on you. Why did we do the test? If you want to share, it's up to you to share. I don't want to violate your HIPAA, but and tell us what all happened afterwards.
Yeah, so I got the testing done, obviously just like anybody else, but I was young, so my body was probably compensating really well. Dr. Purser told me I was malnourished, which didn't seem to make sense because I was an athlete at the time playing football, eating as much food as I could, and he was telling me I was malnourished, but when we drew the CMA, it was in fact that. I did struggle gaining weight for a long time, and so, since I've been doing Dr. Purser's protocol, I've been able to put on some weight, and I'm able to maintain that weight instead of, fighting to keep it. And I don't have to eat nearly as much to do so.
Didn't you grow a little taller too?
Yeah, I think
You were
when
like
we
5'3", and now you're what?
Yeah, I'm about 6'4" now.
Okay,
Yeah.
stand up so they can see.
Yeah.
Yeah. No, I'm kidding. He was at 5. Well, he's 5'4". Sometime in the past. Yeah.
Yep.
There we go. Jump.
That's my son-in-law, by the way.
There we go.
And his dad and brother are built the same way. It's all his brothers. It's crazy. They're a bunch of Thors. From your perspective, what would you tell people about the nutritional testing we perform?
Yeah, I would say it's a great option when you have nowhere else to turn or to get ahead of it. We do have a lot of young patients. Their parents bring them in, and we have a lot of young patients that want to get started early
Not really.
and try to avoid all
Let's
this.
be clear, not patients.
Yes.
Misspoke.
Yes.
Yeah, they're
patients.
They're nutritional people.
Yes, exactly. And so that's a great option to get people started early and get them going early. That way they can avoid those genetic breakdowns later on in life. I think it's a really good plan for them.
It's funny because what we see genetically, I never saw this coming, but I usually see two major problems with they have both of them, or they have one or the other. These major problems either have gut problems and liver and digestive issues, SIBO and pancreatitis, or ulcerative colitis, Crohn's, or diarrhea, or whatever, or they have inflammatory problems, or they have both.
Yeah,
And that's
absolutely.
homocysteine or a PEMT. Let's be clear about that. PEMT and or it's they have both. I do deal with about 4 or 5 patients. They have both.
Yeah,
It's crazy.
yeah, it's pretty nasty.
I never saw that coming.
Yeah,
I never saw that the future of genetic medicine apparently is dealing with bad inflammatory conditions or bad digestive problems.
absolutely.
The inflammatory conditions, though, turn into cancer, heart attacks, strokes, all kinds of bad things. But the PEMT, the digestive problems turn into really bad things too. Genetics is not yet the answer for everything, but it's the answer for a lot.
Oh yeah, absolutely.
So it's really interesting. Thank you so much.
Yeah.
And ow, that hurt. I shouldn't have done that. Thanks. Thanks for letting me. Thanks for letting me talk to you. And,
Yeah, of course.
And this is Justice Woodward, and he's my son-in-law, and he's a great young man, 5-star, and fun to have in our operations. Thanks.